Duphaston tablets. Brand: Duphaston 10 mg tablet, with the brand name Duphaston, is the name of dihydrogesterone drug, which is used to treat various diseases caused by the lack of progesterone. Regarding the question that arises about the use of Duphaston tablets, it should be said that among these diseases are menstrual disorders, painful menstruation, secondary amenorrhea, interrupted or irregular menstrual periods, premenstrual syndrome, and abnormal uterine bleeding. It occurs during the menstrual cycle, he pointed out. Application: Duphaston 10 mg tablet is used to treat endometriosis, infertility and abortion. Also, this pill is used to deal with the stimulating effect of estrogen hormone on the endometrium and the possibility of endometrial cancer. This pill is also used to help stimulate breast growth and reduce testosterone production. Treatment of endometriosis: increasing progesterone with estrogen helps a lot to regulate periods. Even if pregnancy has occurred during the menstrual period, the progesterone that is present in the endometrium and produced by the ovaries prevents the increase of estrogen and the start of the secretion of hormones and other proteins needed to maintain pregnancy, and if pregnancy has not occurred, the level of progesterone has decreased. And as a result, the endometrium is destroyed. Endometriosis means the growth of endometrial tissue outside the uterus. Stopping the growth of endometriosis reduces the symptoms of endometriosis such as pain and bleeding. Treatment of menstrual problems: the normal menstrual cycle depends on the interaction of several hormones, including progesterone and estrogen hormones that are secreted by the ovaries and other hormones and by the pituitary gland. If any of these hormones are not produced in correct amounts, the cycle is disrupted and causes problems such as amenorrhea and abnormal uterine bleeding during the menstrual cycle. Since the use of Duphaston tablets restores the hormones to a normal level, it regularizes the menstrual cycle. Duphaston tablets for hormone replacement therapy. Taking estrogen such as Duphaston as a hormone replacement therapy reduces the symptoms of menopause in women such as night sweats, insomnia, hot flashes, vaginal dryness, headaches, mood changes. Mood, lack of concentration and loss of energy. Regulation of female hormones. Duphaston pill has a progesterone hormonal part, which is used as hormone therapy to strengthen female traits such as breast growth and decrease testosterone production. Medical information: Duphaston 10 mg tablet contains dihydrogesterone, which is a compound derived from the hormone progesterone. Progesterone is produced by the ovary during the second phase of the menstrual cycle. This material in the inner lining of the uterus, i.e. endometrium, transforms the proliferation phase into dissection. This causes the growth of the endometrium, which is thickened in response to estrogen during the first menstrual period, to stop, and it causes hormones and other proteins needed in case of pregnancy to be secreted to maintain the pregnancy, and otherwise, the level of estrogen and progesterone decreases and the endometrium breaks down, which means menstruation occurs. The dihydrogesterone present in Duphaston tablets causes regularity in menstruation, and unlike natural progesterone, it is easily absorbed and can be consumed in the form of tablets at a relatively low concentration. Meanwhile, natural progesterone is not well absorbed by the digestive system. It should be said that unlike synthetic progesterone, Duphaston does not interfere with the beneficial effects of estrogen, including preventing osteoporosis, regulating cholesterol, and it is not chemically similar to testosterone and does not cause side effects such as hirsutism or acne. Amount and method of drug administration. It is better to take Duphaston tablets once or twice a day with a glass of water or with food. You should take Duphaston tablets as long as the doctor prescribes. The doctor may extend the pill intake for 5 days or 1 month. The most common way of taking Duphaston tablets is to regularize the period for 10 nights from the 16th night of the menstrual period, after which you will have a period 3 to 10 days later or pregnancy will occur. Also, it may be 5 days, 1 month or 10 nights and from the night of the 16th or 14th of the period. Sometimes it is necessary to take Duphaston tablets every month during menstruation as prescribed by the doctor. If you forget to take Duphaston tablet, it is better to take it immediately after reminding. Unless it is time for the next pill, in which case it is not necessary to take the previous pill, and the important thing is that you should never take 2 Duphaston tablets at the same time. Drug contraindications. If you are suffering from any of the following diseases, you should avoid taking Duphaston and consult your doctor. Allergy to dydrogesterone or other Duphaston tablets. Abnormal vaginal bleeding for unknown reasons. Thrombotic disorders. Forgotten abortion. History of having breast cancer, endometrial cancer or liver disease in the family. History of thrombosis or blood clot or stroke. Liver disease. Carcinoma of genital organs or breast. Of course, it is worth mentioning that for some people, the use of Duphaston tablets is associated with hair loss, obesity, etc. Warnings and precautions. The use of Duphaston tablets may cause irregular bleeding during menstruation, in which case it is better to increase its dosage. Of course, it is better to consult with a pharmacy doctor or telephone pharmaceutical consultant before taking this pill. Drug interactions. If Duphaston pill, dydrogesterone and bromocriptine are taken at the same time, it causes excessive and spontaneous milk secretion. Medicines that induce the activity of liver enzymes, such as rifampin, phenytoin, and carbamazepine, reduce the effectiveness and effect of the drug if they are taken at the same time as Duphaston. Side effects. Among the side effects that may occur when taking Duphaston tablets, the following can be mentioned. Pulmonary embolism, spotting, nausea, vomiting, chest pain, irregular bleeding, dizziness, weight loss, itching, facial and body acne, change in appetite, swelling of the ankle, retinal thrombosis, thrombophlebitis. Of course, for some, the question arises as to whether Duphaston pills cause pregnancy/in fact. The answer is very simple, and these pills have no effect on getting pregnant. Drug storage conditions. All tablets should be kept out of the reach of children, and Duphaston tablets are no exception. Tablets should not be used after the expiration date printed on the package, and drugs should not be disposed of through household waste or sewage. Duphaston tablets should be stored in a dry and cold environment with a temperature below 30 degrees Celsius.